The tibialis anterior muscle is a lower leg muscle that lies anteriorly, as the name suggests, and is part of a group of extensor muscles. This muscle runs mediocaudally from the lateral tibia, the interosseous membrane, and crural fascia. At the height of the lower tibia, it merges into a tendon which is led by both extensor retinacula of the foot and finally inserts at the plantar side of the medial cuneiform and first metatarsal bone. The tibialis anterior muscle serves as the leading muscle for the neurovascular pathway running towards the ankle, which includes the deep fibular nerve and the anterior tibial artery and vein. The main task of the anterior muscles of the lower leg is the dorsal extension of the upper ankle joint. Additionally, the tibialis anterior muscle causes a weak inversion, also known as supination. This video is more fun than tutorial. We will discuss the origin, insertion, innervation, and function of the gluteus maximus. The gluteus maximus muscle builds the most superficial layer of the dorsal gluteal musculature and so forms the surface anatomy of the gluteal region or buttocks.
The rectus femoris is the anterior member of the muscle group of the anterior thigh known as the quadriceps femoris. The rectus femoris flexes the thigh at the hip and extends the leg at the knee. Gastrocnemius is the large superficial muscle occupying the posterior compartment of the leg. Gastrocnemius has two heads, the medial head and the lateral head. The origin of the medial head is from the posterior femur, superior to the medial condyle. The origins of the lateral head are from the lateral condyle and the posterior surface of the femur. As they pass inferiorly, the two heads converge and give rise to the calcaneal tendon, which inserts onto the posterior calcaneus. Gastrocnemius plantar flexes the foot at the ankle and assists in flexion of the leg at the knee.
Magnus. The adductors of the hip are part of the inner hip musculature and range from the lower pelvic bone to the femur and knee region. The hip adductors shape the surface anatomy of the medial thigh. The focus of this tutorial will be the adductor magnus. The adductor magnus muscle is one of the biggest muscles of the human body. It originates at the inferior pubic ramus, the ischial ramus, and the ischial tuberosity, and inserts both at the linea aspera and the adductor tubercle of the medial epicondyle. The innervation is mainly supplied by the obturator nerve, which arises from the lumbar plexus and reaches the adductors through the obturator canal. The superficial part of the adductor magnus is supplied by the tibial nerve. As the name suggests, the main function of the hip adductors is the adduction of the hip joint. The adductor magnus additionally supports outward rotation, inward rotation, flexion, and extension. Overall, the hip adductors play an important role in balancing the pelvis during standing and walking. This video is more fun.